again welcome Ms. Vignola, who is joining us in place of her colleague. Welcome to meeting number 35 of the Standing Committee on Public Accounts. The committee is meeting in public today and is being televised for the first hour and will move in camera for the second hour to discuss committee business. Pursuant to Standing Order 1083G, the committee is meeting today to receive a briefing from the Auditor General concerning the reports that were tabled in the House on Thursday, May 26, 2021, which were referred to this committee. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021, and therefore members may be attending in person in the room and remotely using the Zoom application. It would appear we are all attending virtually today. So on that note, interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. When you are done speaking, please put your mic on mute to minimize any interference. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of headsets with a boom microphone is mandatory for everyone participating remotely. And again, should any technical challenges arise, please do advise the chair and note that we may need to suspend a few minutes as we want to ensure all members are able to fully participate. I'd now like to welcome our witnesses. Joining us today from the Office of the Auditor General, Karen Hogan, Auditor General of Canada, Glenn Wheeler, Principal, and Jean Goulet, Principal. With that, welcome all, and I will turn the floor over to Ms. Hogan.
Madame la Présidente, j'ai le plaisir de vous présenter
Madam Chair, it's my pleasure to discuss our audit report tabled in the House of Commons on 26th of May. I'm accompanied by Jean Goulet and Glenn Wheeler, the principals who were responsible for the audits.
Reports considers how the government acquired protective and medical equipment during the pandemic. The second looks at how Indigenous Services Canada provided the protective equipment and healthcare workers that Indigenous communities and organizations needed to respond to COVID-19. Both audits showed that there were issues in planning and stockpile management before the pandemic. For example, in our audit on procuring personal protective equipment and medical devices, we found that before the pandemic, the Public Health Agency of Canada had not addressed long-standing and known issues with the systems and practices used to manage and operate the National Emergency Strategic Stockpile. L'agence était au courant de ces problèmes.
The agency knew of these issues because they had been raised in audits and reviews going back more than a decade. As a result, the Public Health Agency of Canada was not as prepared as it should have been to deal with the surge in requests for equipment that were coming from the provinces and territories triggered by the COVID-19 pandemic. In our other audit, we found that Indigenous Services Canada had not followed its own approach to procure sufficient equipment. As a result, it did not have enough of some types of protective equipment in its stockpile when the pandemic broke out. However, both of these audits also showed agility and responsiveness.
Health Agency of Canada, Health Canada, and Public Services and Procurement Canada helped address the needs of provincial and territorial governments for personal protective equipment and medical devices. Indigenous Services Canada did the same for Indigenous communities and organizations. Faced with a crisis, these organizations worked around their outstanding issues with the management and oversight of the emergency equipment stockpiles and adapted their activities. For example, during the pandemic, the Public Health Agency of Canada improved how it assessed needs and allocated equipment to help meet the demand for personal protective equipment and medical devices from the provinces and territories. It also outsourced much of the warehousing and logistical support needed to deal with the exceptional volume of purchased equipment. De même, Santé Canada a...
Similarly, Health Canada reacted to the increased demand created by the pandemic by modifying its management of license applications from suppliers for personal protective equipment and medical devices. Public Services and Procurement Canada also made adjustments by accepting some risks to facilitate the quick purchase of large quantities of equipment in a highly competitive market, a market in which supply was not always keeping pace with demand. If the departments had not adapted their approaches to the circumstances, it is likely that the government would not have been able to acquire the volume of equipment that was needed.
Services Canada also adapted quickly to respond to the pandemic and relied on the National Emergency Strategic Stockpile to fill pre-existing shortages of items in its own stockpile, such as gloves and hand sanitizers. The department supplied Indigenous communities and organizations when provinces and territories were unable to provide them with personal protective equipment. The department also expanded access to its stockpile beyond those directly supporting the delivery of health services to include police officers and people in communities who were sick with COVID-19 or caring for sick family members. Face à l'augmentation de la demande de soins de santé due à COVID-19,
given the increase in demand for healthcare personnel because of COVID-19, Indigenous Services Canada streamlined its processes for hiring nurses in remote or isolated First Nations communities. The department also made its contract nurses and paramedics available to all Indigenous communities. While the department took steps to increase capacity, the number of requests for extra nurses and paramedics also increased. Indigenous Services Canada was thus unable to meet more than half of the 963 requests for extra nurses and paramedics that it received between March of 2020 and March of 2021. Our audits of the government's pandemic response continue to show that when the people who make up the federal public service are faced with a crisis, they are able to rally and focus on serving the needs of Canadians. However, these audits also show that issues forgotten or left unaddressed have a way of coming back, typically at the worst possible time.
As well prepared to face the pandemic as it should have been, had the stockpile of emergency equipment been better managed, and if a long-term solution had been put in place for healthcare workers, such as nurses, in Indigenous communities. If there is one overall lesson to learn from this pandemic, it is that the government departments need to take action to resolve long-standing issues and to see the value in being better prepared for a rainy day. Madam Chair, this concludes my opening remarks. We are pleased to answer questions. Thank you.
Thank you very much, Ms. Hogan. Colleagues, before I turn to the questioning, I have received the speaking order as we normally follow during our meetings. However, in the past, we have taken an approach where we open it up to those who have questions and perhaps get the opportunity to have a 3-minute round. I look to you for your guidance. As I said, I have the speaking order. We would have enough time for the first 4 rounds of questions according to the speaking order. Is it the will of the committee to follow a speaking order this morning?
Yeah.
I'm seeing yes. All right, then we will follow our speaking order, starting with Mr. Berthold for 6 minutes.
Merci beaucoup, Madame la Présidente.
Thank you very much, Chair, and welcome, Ms. Hogan. And thank you for being with us again with your staff. I'm going to be focusing on things that you said in your presentation. You said that the agency was aware of the problems because these had been raised in previous audits and reviews going back at least a decade. And the same for Health Canada and Indigenous Services Canada. Don't you think that you had a unique opportunity to demonstrate the importance of Auditor General reports over the years and the negative impact that can be felt by government departments and agencies if they don't follow the recommendations? I don't feel this in your report, or if it's at all present, it's very timid.
Vous mentionnez un...
Now, you're mentioning an issue, of course, that is of concern to me. One would think that these days, all of my reports refer to long-standing issues that the government has not addressed. I tried to strike a balance in the report on the pandemic to demonstrate that the Federal Public Service has mobilized and has reacted and responded to meet the needs of the Canadian population. But you're completely right. My message here is very similar to my message when I tabled a report in March, and that was the report on the pandemic preparedness. I think the government has to recognize that it's necessary to invest in the things that you don't see. If I may, yes, invest in what we can't see, but also it's very necessary to have. Unfortunate, what I would have liked to see in your report, and explain to me why it isn't there, is the consequences of not having followed. Yes, there was a delay. Yes, there wasn't enough advanced preparation. But what were the actual impacts on Canadians of the fact that Public Health Canada or Public Health Agency of Canada was not ready despite the repeated warnings that it received? That's not really something that comes through very strongly in the report I'm seeing in front of me. Well, it's hard sometimes to demonstrate the impacts. We don't know whether, had the government been better prepared, the response would have been different. I can confirm to you that requests for personal protective equipment in February until mid-March, it took until mid-March before the government looked into procurement, and those requests, only a fraction of those requests were really met. It was very difficult to determine what was actually missing in the national stockpile because it had never been established what the minimum threshold for that stockpile should have been for a pandemic. So I focused on continuous improvement to improve our response. Well, were you able to put a figure on the number of requests that were not met? Well, I could ask Mr. Goulet if he would like to add something to this. We had estimated the proportion of requests that were met with. For example, at the beginning of the pandemic in February, one province requested over 500,000 masks. And I think they received 4 to 10% of the masks. So we were able to estimate the shortcomings, but it was impossible to do it overall. So I don't know, Mr. Gula, do you have anything to add to answer the question? We have specific figures as to requests made by provinces and territories and what was provided to them at the time by the health agency. I can send you those figures, but the proportion that Ms. Hogan was talking about is accurate. Roughly 6 to 10% of requests were met. Is it possible to provide that information? Because I think that's very important, Ms. Hogan. As a Public Accounts Committee, our purpose is to study reports and your recommendations. And really, I want to know how it is that such long-standing requests have not been dealt with. When you look at these reports and when you have an exceptional situation, I'm sure that public servants react in an exceptional way because they are able to do that. But how come that capacity was kept limited when there wasn't a crisis? And so always reacting in crisis mode creates all kinds of problematic situations. So yes, I would like to receive that information as quickly as possible regarding the response. And Ms. Hogan, perhaps, I don't know whether you have any intention of going any further, because I could have made the same findings with Indigenous Services Canada. I think it's important to illustrate that Your recommendations are useful, and this is an opportunity, a particularly crying opportunity for the departments to follow some of your recommendations, if not all of them. Well, thank you very much for your comments. And yes, we will provide you with that information. We tried something very different in these two audits, and that was to do a real-time audit. We found that there were shortcomings, of course, and of course this led to slower response time, slower than what the government should have been able to muster. But instead of waiting until everything is over and then look back and then make comments, we wanted to look at an impact and add value to the country and to the people of Canada by influencing the responses that are continuing to evolve in response to the pandemic.
Mr. Berthold, we will now move to Ms. Yip for 6 minutes.
Thank you, Madam Chair. I would like to thank the public servants and the department for their excellent work and agility in being able to handle some of the quick movements that were needed to fulfill some of the PPE issues. I think it's important to note that. Going back to the real-time audits, this is to Ms. Hogan, what was the advantage of doing these audits in real time?
So there are advantages and disadvantages to doing real-time audits. Some of the disadvantages are that individuals are very busy still trying to respond to the pandemic, and hence we do need to make some difficult decisions about scoping and how far we dig on some issues. But the biggest advantage in such an approach to auditing is being able to have a direct influence and impact on the ever-evolving response to the pandemic. So for example, we were able to make some recommendations to Public Services and Procurement Canada about adjusting some of their approaches and some of the risks that they were taking in bulk procurement to hopefully influence and improve the response going forward. As we know, we're in wave 3. There is speculation that more waves are to come. And if we can help influence the response, we wanted to take advantage of that.
Yeah, that's important to be able to react faster and make improvements. Other than the stockpiling issues, what are some of the long-standing issues that could have been taken care of to be better prepared for the next pandemic?
So trying to answer that by talking about some of the longstanding issues in the two reports. I'll start with the first one where we looked at Public Health Agency of Canada's management of the National Emergency Strategic Stockpile and its response to the pandemic going forward. Here there were a few things that I would highlight. One would be making that assessment of what the standard or basic level of certain types of equipment should be maintained in the stockpile to deal with a health crisis going forward, fixing the IT system that supports that. We saw many weaknesses where they couldn't track expiry dates and had issues even identifying what was in the stockpile. So really taking the time to do all of that in between crisis instead of doing it in reactive mode and really not fixing those longstanding issues, but just finding a better response in the context of the current environment. So that would be that first report. If I would turn to the Indigenous Services Canada report, I think I would highlight the fact that there's been longstanding difficulties at trying to secure skilled healthcare workers in Indigenous communities, and that a solution there needs to be found because the pandemic just made a bad situation worse.
Why do you feel that maybe some of the lessons from SARS or H1N1, the swine flu, hadn't been learned and retained and maybe used as a base in order to prepare for this pandemic?
I would point to two items that I think I've noticed in this series of audits. When we looked at pandemic preparedness, I might have pointed to other matters, but here I think I would talk about sort of the drive of short-term thinking, right? Sort of dealing with the things that are the current things on the table versus that long-term view. And as I mentioned in my opening remarks, really planning for a rainy day. So I think that's a natural tension between Parliament and government, one that we need to recognize that the Federal Public Service has to always make sure that they keep their eye on the long-term thinking and do all those behind-the-scenes work. The second thing I would point to here is that we found it by reviewing internal documents and also in talking to officials, in that the Public Health Agency cited budget constraints and budget limitations that limited their ability to deal with some of these issues and also to restock the stockpile when it had been used.
On the topic of oversight of third-party warehousing and logistics, it stated that one of the reasons why third-party service providers were sometimes unable to fulfill their contractual obligations was because of incomplete information from suppliers. How does your recommendation address this?
So we did provide a recommendation there that enforcing the terms of contracts is essential, right? We spend a lot of time in the Federal Public Service making sure that there are good clauses in the contracts, and then enforcing them is an essential one. So here it was that, the third-party warehouses didn't always have accurate information from the suppliers and hence couldn't fill out the, document what was in the inventory, what was being received and shipped. But there were also limitations in the Public Health Agency's inventory management system that just contributed to the ongoing inability to have a complete record over the pandemic. So it's about enforcing those rules, but it's also about making sure that you have an IT system that supports a really important program, and in this case, the National Emergency Strategic Stockpile.
Okay. There's also in your opening remarks about Public Services and Procurement Canada making adjustments by accepting some risks to facilitate the quick purchase of large quantities of equipment in a highly competitive market where supply was not always keeping pace with demand. What kind of risks were deemed acceptable?
Ms. Hogan, I would need this to be a very short answer as we are already over time.
All right, I will do my best. I would highlight then just two things. One would be invoking the national security exception, which allows for a non-competitive processes. And the second would be accepting the risk of making advance payments in order to secure equipment to replenish the stockpile and deal with provinces and territories' requests.
Thank you.
Thank you very much, Ms. Yip. We will now go to Ms. Vignola for 6 minutes.
Merci beaucoup, Madame la Présidente.
Thank you very much, Madam Chair. Ms. Hogan, Canada has warehouses made to store materials in case the provinces and territories need them. But a few weeks before the pandemic began, thousands of outdated masks were thrown out. To your knowledge, did Canada have any kind of tracking system that any company would have that doesn't want to throw its money out the windows or into landfill sites in this case? And in the procurement strategy, has Canada found a way to ensure that in the future it won't have to depend on foreign countries in order to meet its needs? So you're raising one of the shortcomings that we found in our audit. We found that the electronic inventory management system of the national stockpile was not efficient. The government was not able to track the expiry dates of some of the equipment that it had in the stockpile. For this reason, it wasn't able to take action if necessary. We recommend that they have an overall better management system for the stockpile, and that includes having technology that provides data enabling sound decision-making. The stockpile was not in any position to provide the information to see, well, why they reacted in the way that they did. We saw that major data was lacking, very important data was lacking. We saw that there was a trend to use Canadian suppliers, but there was a lack of supply in Canada to be able to create PPE. So we didn't really look at how this market was increased. As I've already mentioned in the tabling day, I think that this is an issue that I'm considering for the future, because this issue is something that would help us to determine whether Canada has positioned itself to be better prepared and to have some Canadian reliability in terms of Canadian suppliers to be better prepared for a next crisis. Thank you. What preventive measures were taken by Canada between the World Health Organization emergency public health announcement regarding coronavirus, which was on January the 30th, and the declaration by the WHO, and then the equipment shortage was in early March? How did Canada react between January 30th and the beginning of March? Well, between January 30th and early March, we saw provinces and territories begin to request equipment. As we've mentioned in an earlier answer, they tried to meet the needs, but they couldn't meet them fully. So in early March, they transitioned to bulk procurement. PSBC devoted a team of buyers to support this initiative. And they continued after the month of March to determine a better way of assessing needs so as to better buy whatever equipment was necessary. But initially it was highly reactive, and the government was trying to just obtain equipment to meet the needs. Briefly, Canada sent tons of medical equipment to China to help China with its own fight against the coronavirus. Isn't it odd that Canada would be sending materials to the country who has managed and continues to manage to serve the entire planet? The government's Canadian actions are not something that we looked at. But if I refer to my report of the month of March, the government was not equipped to better identify risk, and the risk of COVID-19 to our country. This perhaps could explain the actions taken, but we really didn't look at the humanitarian actions that Canada took before the need to change the approach and be focused on Canada. We were really looking at the Canadian approach in terms of PPE. Thank you. When I look at the diagram at 10.2, I see that Public Health Agency of Canada has to assess the provinces and territories' needs as transmitted and authorize equipment and supplies. Could there have been an assessment that the provinces and territories actually didn't even need as much as they were asking, and could the quantities have been reduced or refused? I assume this wasn't done. I'm quite sure of that. But is this something that it could have done, that it was empowered to do? Well, early in the pandemic, we found that there was a lot of confusion. There was a lack of information federally in terms of the accurate and exact needs of provinces and territories, as well as the level of provincial and territorial stockpiles in their own stockpiles, because they each have their own stockpile before they make a request out of the national stockpile. We saw that there was a change in collaboration over the course of the pandemic, but initially there was really a lack of information. So yes, it is within their powers to not respond, but it's because they didn't have the equipment and not because it was in their power to not respond. In other words, to be 100% sure of being able to get the necessary equipment or materials, the provinces and territories could have acted independently and make their own decisions. Well, I think I have to answer quickly. I see the chairs making signs, but the way it works, every province and territory has their own stockpile and should use that stockpile and try to meet their needs with it. And when there's really high demand that they're not able to meet, then they should turn to the federal government for the national stockpile. And at that point, it becomes a collaborative effort. Even if the reserve can't meet it, it could ask other provinces to support them. Thank you.
Thank you very much, Ms. Vignola. We will now go to Mr. Green for 6 minutes.
Thank you. And I'm certainly, happy. I know my residents here in Hamilton Center are happy that we're having this discussion about the National Emergency Strategic Stockpile. It's something that I've been on for quite some time, both in this committee and at my other committee at Government Operations. And I want to pick up where Ms. Yip left off on some really good questions about post-SARS. Everything I know about this, that this is something that we've known to be a possibility. we've created an organization called the National Emergency Strategic Stockpile. And yet we've heard testimony today that the planning was driven by short-term thinking with possible implications in and around the budget. So through you, Madam Chair, to Ms. Hogan, whose short-term thinking? Who would have been responsible to make the decisions and the recommendations to put forward to the minister, inevitably, likely cabinet, that would have resulted in the shuttering of 3 out of our 9 national emergency strategic stockpiles?
So when I reference to short-term thinking, I sit back and I look at all the work that we've done so far on COVID response, and I look at the pandemic, the response to the pandemic report that I issued in May, as well as this report here, is that we're seeing that there's a lot of response to being reactive, and we deal with H1N1 and SARS, and then we know that there are things that need to be addressed as a government, but then we deal with the next crisis instead of really planning for that rainy day. And so I believe that there are the oversight committees, so the departmental audit committees within the entities, the departments themselves, the deputy ministers, as well as really just the tension that comes with the need to invest in things that people see versus the things that we don't see, and so it's a tension between the political world and the federal public service that I think also pushes some of that short-term thinking. So I believe that as a whole country, municipal, provincial, and federal governments, we need to recognize and learn from this pandemic that we have to sit down together and coordinate a better response.
But we did that.
For the next crisis.
We did that post-SARS. And if I recall, Dr. Tam was one of the authors of some of the original SARS responses, Madam Chair, through you to Ms. Hogan, and actually planned for, at some point in time along the way, somebody made the decision to have 9 national emergency strategic stockpiles, keyword emergency, based on our experience with H1N1 and SARS, that would have had some kind of national standard. And this is where I get really caught up. So in the audit, we hear that there was lack of data, lack of information, lack of systems. In your review of internal documents, did you come to a finding that presented a national standard for the supply levels of each of the products that would be stored in the National Emergency Strategic Stockpile?
No, we were unable to locate an assessment about that. We've been unable to find a national or even an international standard on basic levels that should be in stockpiles. I think it's fueled by so many inputs. Right, you need to understand your population. You need to understand what type of medical response might be, struck up to deal with an emergency. And so, for example, in the current crisis, N95 masks were very important because the virus was airborne. The next crisis, it might be a different piece of equipment. So it really is about ensuring that you have some equipment and then flexibility to increase access.
On that point, somewhere along the way, somebody saw fit, they had the wisdom to purchase millions of N95s. They knew that SARS and H1N1 were also airborne. We had in Regina 2 million N95s thrown out. We know that there were 2 other warehouses shuttered. In your review of internal documents, did you come to a finding that there was a consistent supply of products in each warehouse? For example, if it is true that there was 2 million N95 masks that were expired in Regina, is it safe to assume that there were also 2 million in the other 2 locations?
So unfortunately, I can't comment on what would have been in the provincial and territorial stockpiles.
No, the federal one. We had 9 national emergency stockpiles. Somebody made the decision to save a couple $100,000 to shutter 3 of them.
So in
shuttering the 3, right, 2 million were thrown away in Regina. Logic tells me that there's likely a likely scenario in which there were 2 million in the other locations, which were also expired and thrown out.
So there were 9 warehouses that housed all of the equipment in the stockpile. I'm not sure you can make the analogy that there were 2 million masks in each of the 9 locations. So there were 9 warehouses that stored all of the equipment in the stockpile. As I mentioned earlier, the data in the system was too weak for us to be able to come to some of those findings.
But just to be clear, just to be clear, my understanding is that these national strategic stockpiles were distributed across the country to have regional distribution to all the different provinces. So logic would tell me that each one of these warehouses would have within them contained the appropriate population density to distribute all of the products listed within the stockpile, no? It's not like you would have N95s in Regina and then gloves in Montreal or something like that. That wouldn't make any sense logistically.
I'm not sure that I actually looked at the logistics about how they were distributed, and maybe Jean Goulet can add to some of that, but it really wasn't our focus. Our focus was on how was it ready to respond? Was the stockpile ready to respond? And then how did the government respond, and how can we influence and adapt it going forward?
Can I request that comes in writing, please? Can I request that any analysis on any of the findings on the internal documents related to the distribution from the audit come back to the committee in writing?
Absolutely. You've received that request, and we look forward to receiving it. We will now go to our next round of questioning, starting with Mr. Lawrence for 5 minutes.
Thank you, Ms. Hogan, and thank you for your continued excellent work. As you might have suspected, based on the earlier questioning of the open, I'm going to continue where Matthew Green left off with respect to, and I think I know the answers, but I just want to clarify it on the record. And I'm just going to go down N90. I'm just going to ask about N95 masks specifically because I think it's representative and it was particularly important during this crisis, as you said. So as of January 1 of 2020, did the government know how many N95 masks they had?
I'm going to ask Jean maybe to add some of this granular level of detail that I'm not necessarily sure I have all stored in my head. So I'm going to see if Jean can answer that one.
So based on our review of their systems, the agency came back to us and said yes, they knew. But looking at the data and doing our analysis, there was no way we could rely on the information that was provided to us by the agency. What we can tell you is there was a large request that came before bulk purchasing related to N95 masks. I can tell you the numbers and I can tell you how many were shipped. The numbers coming in from the provinces and territories were about 3.2 million, and what was actually shipped was 130,000. So this gives you a magnitude of what the needs were from provinces and the capability of the agency to reply to those needs.
So sorry, just to clarify that, and thank you for the excellent information. The N95s, there were 130,000 N95 masks shipped to the provinces from when to when?
So that was prior to the implementation or just after the implementation of bulk purchasing. So from February up until July and August.
So only 130,000. And what was the number, sorry, again, that you said that what the total amount was requested? My apologies.
Around 3.2 million.
Wow. So less than 1% if my math quickly holds up there.
4%.
4%. Thank you. Yeah, that's why you're in the Auditor General's office, and I'm just a politician. So no, I appreciate that. So, but just to get back to the original point, so the government did not know, or at least it wasn't reliable data, how many N95s they had in the stockpile as of January 1, 2020. That's your evidence, correct?
Our evidence is that the information that they were provided with could not be relied upon.
Okay, and I mean, my subsequent line of question I think is moot, but I'll still ask it just to get on the record. The N95 of those N95 masks that would have been there, did the government have any type of tracking as to how many of them had expired?
There was tracking, but again, this is one of the areas where we found some deficiencies, so we could not rely again on that information.
So the government really. Well, I'll use your language, did not have, I guess, reliable information to tell them how many N95 they had, whether they were expiring, and they only shipped out 130,000, 4% of the total provincial request. Is that correct?
That is correct. But remember, again, here, this is the mandate of the agency is to provide to reply to needs from the provinces if it exceeds their capability. So it's what we call a surge capability.
Okay, and the other thing I wanted to clarify is, so that's so the 130,000. It seems to reason that that might have been how many they had. That just sort of logic indicates to me. But we don't know how many they should have had. There was no number out there as to what should have been the amount of N95 masks prior to January 1 of 2020. Is that correct?
Yeah, correct. That was one of the issues identified in the 2010 internal audit by the agency, that they needed to do that assessment about what should be in the stockpile, and it had not been done. And the evidence that we found was that it had not been done because of budget limitations, and so they hadn't addressed that. So
Okay.
it was difficult. You have nothing to compare it to, right?
Yeah, no, for sure. You don't know where the threshold is. I hear you. So with that, so you mentioned a couple times budgetary restrictions were a primary limiting factor in terms of having the proper amount of N95 masks. How many requests did you see to the government? Were there any requests, I guess I should ask, for additional funding for the stockpile from the various public services?
I'm going to have to turn to Jean again. I should have just let him keep going with the answers.
A very short answer, Mr. Goulet.
So we don't know whether if there's an exact number. Basically, this is what officials at the agency told us, is that because this was of budget constraints.
Thank you very much, Mr. Lawrence. We will now go to Mr. Longfield for 5 minutes.
Thank you, Madam Chair, and thank you to Ms. Hogan and to Mr. Goulet for being here to answer our questions today. I was interested on a couple of areas. One was on the nurses and paramedics and the hiring of staff for Indigenous services. In 11.55 in your audit, you mentioned 77 nurses had been hired for the 51 remote communities prior to the pandemic, and that 147 additional nurses and paramedics had been hired during COVID. It seems to me we would be in really tough shape if we hadn't started a hiring for the in remote communities before the pandemic hit. But I know retention is a problem. Friends of my wife and I have had gone up to one of the remote settlements to work with, or one of the remote nations to work with education, and she did about a year's service there and then didn't renew her contract. Turnover is part of it. I'm wondering how many of the 77 that were hired prior to the pandemic were still in place, whether we've got a net new hire there. And I also know that in our community, the local long-term care facilities had a lot of trouble hiring during COVID. People were getting scooped by the hospital where they got more money or different hours, and some of the long-term care facilities really had trouble keeping staff. Did you look at turnover in your audit?
I will eventually turn to Glenn Wheeler and see if he can add something about sort of net new hires. What I can say to you is that streamlining process that we saw Indigenous services in Canada apply during the pandemic in order to increase the amount of nurses they could hire for those 51 remote communities where they're responsible for delivering health services was really effective. And that's why we recommended that they should consider whether or not that should be a process going forward. But you're absolutely right that attraction and retaining is a very long-standing issue in those communities. It's driven partially by a national shortage of nurses, as you've mentioned and alluded to, and we saw the pandemic make that worse. But also about the challenging nature of the work. Often the nursing stations are manned by one or two individuals who have to deal with a complete host of issues, all along the spectrum of medical responses that is needed. And then there's always the ever-present inadequate housing issue that we see in some of the remote and isolated communities, such that retention is complicated. So I don't know, Glenn, if there's anything that you wanted to add about turnover and staffing that you might have covered.
Madam Chair, no, we did not do an assessment of the turnover rates the 77, but it would be fair to say that there was some turnover. And as the Auditor General mentioned, that's a long-standing issue that we've seen in many audits going back over several years, and it points to the importance of, as we said in other audits, of taking various steps to increase capacity, including trying to educate, recruit, and retain folks from Indigenous communities and from the North to take those positions, because there is probably a greater likelihood that if you're from an Indigenous community or from the North, that you would be more likely to stay over the longer term.
Right.
But to answer your question, we didn't look at turnover rates.
Right. Yeah, building their own capacity within
That's
their own
correct.
nation. Yeah, very good. And of course, the audit and COVID itself just highlights that there's more work to be done. During our audit discussions, inventory comes up a lot, data comes up a lot. We had that on our defense audit as well. I was really interested in the PPE report 10.55 or 10.50 was talking about the using third-party services, something I was familiar with back in my previous industrial career, where you'd have vendor-managed inventory. And so you would have guaranteed stock managed by a vendor of that stock, and it would be held outside of the warehouse or maybe even inside the warehouse, and the vendor would manage the inventory in your warehouse. Interesting concept, and it looks like that's something you came across in your audit, that this is something that's being used as of September 2020. Could you comment on maybe the long-term impact of that type of strategy, and maybe how it might impact other departments like defense?
Well, what we saw during the audit and looking at the warehousing, that the additional warehousing that was used in order to deal with the volume of mass purchasing that occurred, is there was a software that was developed that would allow provinces and territories to actually have visibility on when personal protective equipment and medical devices were received in a warehouse and when they were being ready to be shipped out to them, so that they could track it better. But those warehouses were still using Public Health Agency of Canada's inventory system, which continued to contribute to some of the longstanding issues. So what you're saying is absolutely an area they could explore going forward. One they didn't explore in a reactive mode, but afterwards they should think about.
Thank you.
Thank you
very much, Mr. Longfield. We will now go on to our next round of questioning, which is a 2.5-minute round, starting with Ms. Vignola.
Merci beaucoup, Madame la Présidente.
Thank you very much, Chair. I'd like to continue along the lines of what I was saying earlier. You talked a little bit about this, but after your findings, wouldn't you say it's more efficient to reconstitute the strategic stockpile inventories from local suppliers rather than implementing proactive inventory management, to have them go through our healthcare systems or charitable organizations? Wouldn't it be more strategic? I think there are many options to better manage this reserve, the stockpile in the future. During the audit, there was the management of the stockpile, and then they stopped looking at that at one point to underscore the procurement of masks, the bulk buying, having third-party support for inventory management because of volumes. They really didn't address the existing shortcomings. So everything that we're seeing was acting in reaction mode. There's an analysis that the government should be conducting to be able to be better prepared. In terms of local suppliers, yes, that would make it faster to be able to respond to needs in the future. Now, you were saying that Public Health of Canada was not well prepared, but they were able to react. Would it be good to have some permanent standing measures, or after the crisis passes, will we end up back in poor preparation and improvisation mode? I think Public Services and Procurement Canada was willing to accept more risks and find the right balance between risk management and the need to be reactive and responsive. They decided not to use certain processes to improve the rapidity of the response. But you have to look at the whole supply process, which is to reduce risk, but it will never eliminate risk altogether. The idea is to strike a balance. You have to manage risk and rapid responsiveness in the future.
Ms. Vignola. We will now move to Mr. Green for 2.5 minutes.
Madam Chair, I think the members of this committee would agree that there have been startling revelations today, in particular, the understanding that in 2019, this department, public health, throws out 2 million masks in Regina. We know that there were requests coming out of the province for 3.2 million masks, and yet the government was only able to respond to a little over 100,000 N95 masks, critical N95 masks in a disease that is respiratory, airborne in nature, from February all the way till August in the height of the first wave. And so I heard through you, Madam Chair, to the Auditor General, talks of audit committees, systems that would have been set up for quality control. So I'm going to go back to the original question. Who was responsible for these decisions, and who is responsible for the audits and the oversight?
Well, if you're looking at the Public Health Agency of Canada, as we mentioned in our audit, we felt that governance was something that was lacking in order to ensure a good follow-up from their 2010 internal audit. So an internal audit usually contains management responses. It is senior management. It's the deputy minister that is responsible and accountable for actions to be taken. There is an advisory role that the Departmental Audit Committee plays in ensuring that that action is taken. And hence why we concluded that we felt governance needed to be improved because no one had acted on action plans that they had committed to.
So with that being said, through you, Madam Chair, I've asked this question to the minister responsible. I've asked this question to Dr. Tam, and now I'm going to put it to the Auditor General. At what point in time in the governance model, in this structure, would the cabinet have been briefed on these shortfalls and appraised that the funding was the issue that created this catastrophic failure in the nest to begin with?
I'm not sure I can speak to exactly what would have happened back in 2010 and 2013.
Sorry, this would have been 2019. The decisions to close the nest what happened in 2019 under this Liberal government, and yet, we can't seem to find who made the decision.
So I don't believe there was a decision to close the National Emergency Strategic Stockpile. The decision was made to focus on being able to mobilize in a different way to respond to the surge in need.
And the response, I think you would agree, was a 4% delivery rate on N95s at the height of a global pandemic. That's a catastrophic failure. Would you not agree?
Very quickly, Madam Hogan.
I would agree that they didn't respond to the needs, and from that perspective, the National Emergency Strategic Stockpile was not ready to support a pandemic.
Thank you very much, Mr. Green. Colleagues, we have 2.5 minutes left before we end this portion of our meeting. I would be happy to steal a few minutes from our committee meeting business if you would like to finish up the last round of questions. I'm seeing some thumbs up. Yes. All right. The next round of questioning is a 5-minute round, starting with a Conservative member, and I do not have
Mr. Lawrence.
Mr. Lawrence. Thank you very much, Mr. Lawrence.
Thank you very much. I just want to go back to the N95. So we've established that the government didn't have reliable data with respect to how many they had, with respect to how many had expired. Do we have reliable information that tells us how many were thrown out in the first quarter of 2020? And do we have reliable numbers as to how many were given away, particularly to the communist Chinese regime? If you could kindly answer those, that would be fantastic.
I'm sadly going to have to turn to Jean again to probably answer this, but I'm going to garner that the question will be no, we didn't have reliable data. It would all have been contained in the same system, following the same mechanisms and processes. And so if you can't have reliable data on what was there and what those expiry dates are, chances are you don't have it as well on ins and outs. So Jean, would you like to expand on that?
I confirm we can't, to the best of our knowledge, we're not aware of masks being thrown out when the pandemic started. But again, we don't really have reliable information to that effect. With regards to masks going to China or any type of other equipment going to China, we didn't really look at that for the reasons that Mrs. Hogan explained earlier on.
Okay, I'm going to pass it over to my colleague, Mr. Berthold. But before I do, I just want to tell you that one of the reasons why I focused on this is because I had someone who's close to me, a healthcare professional working in an Ontario hospital, who was asked to reuse N95 during the front line during the COVID. This is very serious consequences, and so we can never ever let this happen again. To you, Mr. Berthold.
If I may, Madam Chair, I agree with the member's comment. I too have family members who are frontline workers, and the country has to do better the next time around.
Merci beaucoup. Rapidement, Madame Hogan.
Thank you very much. Very briefly, Ms. Hogan, I'd like to get back to what I was talking about earlier regarding how important this report is and the importance of highlighting the failures so as to be able to see change in the long term. We've seen that the machine can react in the short term, but it took 3 months before we were able to adapt. And during that 3-month period, public health agencies were recommending that Canadians not wear masks because there weren't any masks available. So there were disastrous consequences on human health for Canadians. And Public Health Agency of Canada has to bear responsibility for this lack of following your recommendations. So, Ms. Hogan, how can you get a clear message across to Public Health Agency of Canada, to the department, because you found that only 4% of mask delivery is just unacceptable? That's an inability to respond to needs. And how have you been able to, or how are you thinking of getting the message across so we don't see a repeat of this failure? I think the message that we are sending now, and the whole conversation we're having now, is that it's unacceptable to not address shortcomings when you're aware of them. We wanted there to be a focus in this dialogue on improvement and how to change how things are being done, rather than, focusing on why were things as bad as they were and why was the stockpile not ready. We could spend a lot of time on that whole issue, but we really want to ensure that things improve. But how can you be sure that the steps taken in an emergency context will have long-term repercussions? Because right now, the steps taken were to meet the urgent needs and to be done quickly, but the problems exist. There are structural problems that continue to exist. So yes, it's all fine and good to want to look at what was done well, but how can we avoid a repeat of the same mistakes? I'm not seeing that urgency in your report for that aspect, which was something that hit Canadians so hard. Well, thank you for that comment about the report, and we'll consider that in our future reports. I think to ensure that it doesn't happen again, that requires a lot of individuals' efforts. It's parliamentary committees, deputy ministers. Our office has to continue follow-up. Provinces and territories and governments have to sit down and deal with all of those issues so as to better manage health.
Berthold, our last questioner will be Mr. Sorbera for 5 minutes.
Thank you, Chair. We're saving me for last. Okay. Good morning, everyone. To the Auditor General, when these reports were issued on May 26th, obviously, with much scrutiny and so forth. So I want to first thank you and your team for the great work that you're doing. I want to refer to your opening remarks on terms of paragraph, I have they're numbered here, 6, 7, and 8, where you talk about the agility and responsiveness of the individuals that work for the federal government in the various departments. I would like you to elaborate, please, you and your team members to elaborate on these two words of agility and responsiveness, because, you know, we faced a once in a 100-year pandemic, and it required the muster of resources from across the federal government, from the Canada Revenue Agency to the various departments to PSPC. We see the vaccines that have arrived in Canada. We see Canadians being vaccinated, and for statistical facts, almost 73% of the residents of the region I live in have actually received their first dose. So great work being done by all levels of government, lots of cooperation. But going back to these two words of agility and responsiveness, can you comment to that, Auditor General, please? And good morning to you, of course. Bonjour.
Thank you. I'll try and do it quickly and cover both reports if I may. So if I look at the Public Health Agency of Canada and Public Service and Procurement Canada with Health Canada, the agility and responsiveness that we saw there, I would outline in 4 ways. There was a long-term national supply and demand model that was developed in order to determine the needs across the country. That model was then used to help inform bulk procurement and have it be more accurate. We saw the Public Health Agency of Canada move to bulk procurement, which was led by Public Service and Procurement Canada, where they took on some additional risk, but was able to secure large amounts of equipment in a very competitive market where supply was often not keeping up with demand. The third thing we saw was that the Public Health Agency of Canada outsourced a great deal of its warehousing and logistics in order to deal with this massive amount of volume. And they did that in a temporary way because it is just surge capacity. And then finally, after the discussions over, the issues about managing who had what in which stockpile provincially and territorially, we saw the provinces and territories with the federal government collaborate on a scarce resource allocation strategy. So that's when the purchases were just not meeting the demand. How would they equitably distribute what was received across the provinces and territories? So all of that was evolving and continue to improve throughout the pandemic. If I could quickly turn to Indigenous Services Canada, the responsiveness we saw there was that they were actually able to meet all of the personal protective equipment requests from Indigenous communities. They too developed a tool, a calculator to figure out how much every community might need. And they streamlined processes and increased a pipeline of workers. While it didn't meet the surge, they still were able to increase how many healthcare workers were in communities.
Okay. Thank you for that, Auditor General. And as we move forward, a lot of lessons will be learned for potentially the next time. And when you think about what you and your team witnessed, can you sort of draw on 1 or 2 lessons that the various departments you think have come away with that will ensure that we have this same agility and responsiveness for Canadians?
I hope they recognize that being in reactive mode is hard and difficult and isn't sustainable. And so actually planning and addressing longstanding issues is absolutely needed. As I mentioned earlier, investing in the things you just don't see, whether it be an IT system that supports an important program, whether it be replenishing the stockpile with gloves and masks and determining how much should be there, or addressing longstanding healthcare issues in the Indigenous communities. I hope they realize the value in taking care of those things moving forward instead of always being in reactive mode. We saw great collaboration, and I hope they continue to build on that with their provincial and territorial counterparts.
Okay, thank you. Chair, I am done.
Thank you very much, Mr. Sorbara. I would like to thank our witnesses for joining us. We will now move into the next portion of our meeting. And I would remind members that you have to log out of this public meeting and log into the in-camera meeting with the information that was sent to you in the same email as the information for this meeting. We are suspended.